brothers and sisters. My name is Sindiso Solontsi. I'm a medical anthropologist and psychologist with focus in clinical psychology. Currently doing researches, managing the South African Institute for Arts, Public Health and Medical Anthropology, of which we're currently having a lot of consultations from various institutions in South Africa in profiling, in public health research and documentation in various areas, of which we're focusing on mental health, psychiatric anthropology, which falls within medical anthropology and cultural psychiatry, and also are dealing with health and wellness, which involves nutrition, obesity, and related dietary processes. And also our research covers public health, which is directed to the communities of South Africa and various social cultural backgrounds. And South Africa is such a very country where HIV have evolved recently over the past 20 years, and it has affected a large amount of communities. So various interventions in terms of primary health care, it's quite necessary. And also there have been recent researches that have been showing the ignorance of our people in relation to how HIV issues have changed and transformed over the past 5 years, in terms of how people behave and actually how they maintain their health conditions. So it's one of the most interesting issues that we need to take into consideration when we protect ourselves. As we know that health is wealth, and becoming health as a nation, it also contributes to other developments of the economical sector, because if we have our people getting sick, we get affected from the economy because people will be going to hospitals, people wouldn't go to work, and most of the people are dying nowadays because of the HIV/AIDS problems and related illnesses like TB and even the most curable illnesses. But the challenge have been on the antiretrovirals, of which various interventions have been of very critical importance, and also primary health care, how people should protect themselves, how people should use herbal medicines which are quite accessible in relation to their lives, of which they would get the proper nutrition in order to maintain their lives. So HIV/AIDS have kind of recently become being termed as one of the chronic illnesses from around 2011, 2012, and now people, they consider it as a chronic illness of which you can stay for more than 40 to 60 years of age, of which people actually end up dying of other complicated illnesses, not necessarily being HIV/AIDS. So information and knowledge is quite very important when it relates to such kinds of illnesses. Some of the problems have been denials from our people, of which they have went on like practicing unsafe behavior, of which then it ended up affecting their lives, of which how they accumulated diseases like HIV/AIDS, and then it becomes a complication. Most of the poor communities are still struggling in terms of accessing antiretrovirals, of which they are quite expensive nowadays, of which a large amount of effort is needed in terms of awakening, especially directed to the youths, so that the more the youths grow, they grow up with a proper understanding of these kinds of information. So based on my own experiences, like I really get affected by an HIV/AIDS epidemic from the very earliest onsets of my own life, of which it affected one of my family-related persons, of which I had to take care of her, I had to protect her, I had to experience how AIDS was, and it was during the time when stigma was quite rife during that period, to the extent that I couldn't even disclose such situations, but the symptoms could actually tell a person who was experienced in terms of knowing the consequences of an HIV/AIDS, of which then I suffered the most and I became the victim. Now I'm actively wishing that my own people, our own community, can benefit, from the educational programs of HIV/AIDS, and also to protect and prevent themselves and those around them. But those who are already affected by the HIV/AIDS epidemic would behave properly in terms of protecting themselves, not to think that they will infect other people, because it's not good, and it will also exacerbate or accelerate or develop much further the illness. So it's quite very important that they keep on protecting themselves, maintaining a healthy diet, exercising, maintaining the proper nutrition, of which is sweet would be high in protein. And then one of the necessities is that the CDH count, of which it must be at least not less than 250, it's quite necessary for maintaining a healthy way of life when people are affected by the HIV/AIDS epidemic. So in as far as medical anthropology and psychiatric anthropology and psychology, they are quite very much relevant in terms of developing the interventions that would really ultimately protect our public communities in relation to these illnesses. So I will be continuing with you based on these researches, of which they are targeted for the Medical Research Council of South Africa, and they will be ultimately published for our own South African and global community, and also to benefit the medical sector, at large. So I appreciate that you will be continuing learning about these developments, and also we will be sharing much to you to get acquainted, in terms of the processes of which to follow when it comes to protecting ourselves, when it comes to these diseases. So I will be catching up with you later on, when we are talking further about obesity, transmittable diseases, and contraceptives, which have been related to abortions, rape, and unsafe sex practices among the youths, even among the adults, So it's very important that we maintain a balanced way of understanding, so we have a proper information when it comes to these health processes. So in as far as our research involving field work, involving ethnographical profiling, surveys, library consultations, and direct interviews from our own participating people in our program. In as far as medical anthropology is concerned, it actually directly do its own assessments on people, unlike in other medical areas where they will experiment with the rats and other kinds of animals. Medical anthropology actually experiments directly with the people, but our people are being respected because they are our sources of information, and the information that they actually give out is a reliable information that relates to the experiences and how they actually live generally in the society. So these are the interventions that we'll be publishing them via the visual documentation, publications, articles, and essays via various mediums, also video documentations, and soon we will be developing much further on our social networks, Twitter, Facebook, and updating our website. At the present moment, you can check us on Priceless SA. That is our website, www.priceless.sa, of which is focused on public health here at the University of Wits, in relation with our South African Institute for Arts, Public Health and Medical Anthropology, in partnership with Medical Research Council and the South African Laboratory Association. These interventions are quite very much important for upcoming generations, and I hope that you'll be following me, and I trust that you will maintain a healthy lifestyle and join our club, HI24 here in Pretoria, of which we'll be also developing it here in Johannesburg, whereby we're teaching about nutrition, exercise, and living a healthy lifestyle. And also we help our people with weight loss challenges, energy, skin problems, and general health and wellness. you feel free to contact us at 0725379348 or email me directly at sindisowolde@yahoo.com, or you can either visit our Facebook pages, South African Institute for Arts, Public Health and Medical Anthropology, or alternatively you can visit Pretoria Herbalife Health and Wellness Counseling. So this is how we are going to be stopping at the moment, and we'll be continuing with our public health intervention.